Fifth metatarsal fractures of the foot are very common in athletes, but they occur in everyday people too. Which of those fractures usually need surgery and which ones can be treated in a cast or boot? My name is Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you feel, look, and perform your best regardless of age or injury. I'm recording this video basically in response to somebody's question that they left in the comments on one of my videos that I had previously recorded on fifth metatarsal fractures. And I thought it was a good question because these are very, very common injuries. Basically, the fifth metatarsal, if you're looking at my model of the foot, it's the long bone on the outside of the foot or under the pinky toe, for lack of a better term. Now, they can be broken in different places, and largely that plays a role in which ones need surgery. They can be sort of on what's called the tuberosity right at the base. They can be a little higher up, sort of at the growth spot. You may see that in kids, and then a little higher up, sort of at the junction where this flare then becomes sort of the shaft or the cylindrical part of the bone. And everybody's a little different. Athletes, soccer, football, basketball, and you've probably seen a number of pro athletes that have had that surgery, typically break it at that junction between what's called the metaphysis and diaphysis, where there's really poor blood supply and there's stresses that pull those parts of the bone apart, making it very unlikely to heal without some kind of surgery. And so those almost always need surgery, whether that's a plate and screws or a screw down the center of the bone, but those almost always need surgery. As you get older and it typically becomes more of a fracture at the base of the metatarsal, very often those heal in a boot or sometimes a cast. It's really based on the exact location. It's based on the sort of the age and nature of the person that's undergoing that. And so it's really tricky. The upside of the surgery, again, putting a screw down the center of the bone or a plate and screws, is it certainly in those what are called Jones fractures or fractures in the worrisome area of bone healing, is that it increases the likelihood that it healed. Doesn't make it perfect, but it increases it significantly. The others very, very reliably heal on their own. Those tuberosity fractures that occur typically in older patients and in the location that younger kids, teenagers and younger typically get them, those heal very reliably, again, in a cast or a boot. So it's a good question to ask your orthopedic surgeon based on what the x-rays show where the fracture is and what you do. That very likely dictates the treatment of it. Now, if you have an orthopedic injury and you want to hear about options other than surgery and other than cortisone shots, click the link in the description under this video, fill out the contact form, and you can learn more about scheduling an appointment to see me potentially as a patient. Also, I'd love to hear your experience with your fifth metatarsal fracture. Leave those in the comments below this video. Just know if you leave a question in the video comments, I can't give you medical advice. But what I do is I try to answer those questions in future videos like this one. Make sure to subscribe to this channel. Click the bell to be notified when I release a new video and when I start my Ask Dr. Geier live shows. Thanks for watching, and I look forward to helping you feel, look, and perform better than ever.